Well, good afternoon and welcome to Waco City Hall. We're on the third floor observing social distancing. Those of us who are in the room have our masks on. We want to welcome you to our weekly press conference that we host here at City Hall. And we have five very good specialists that again will participate. Real quickly, I want to let you know the fact that we're down in our studio on the first floor, we're providing an American Sign Language interpretation for those who need those services. And we also are recording a separate audio track in Spanish for the entire commentary of going on today that will be replayed this afternoon at 4:30 on our city cable channel and on our live web stream. And here again to invite our Spanish speakers to tune in to that, to get all the information we're going to share, is our City Council member for District 2, Hector Sabito. Hector, always glad to have you here. Thank you for being here.
Larry, thank you again for the invitation. Para ayudar a nuestros ciudadanos que hablan español a saber lo que se dice durante esta conferencia de prensa, un traductor está grabando una traducción en español en vivo durante esta conferencia de prensa. Esta grabación completa en español reemplazará el sonido del inglés en el video y una versión en español de toda la conferencia de prensa se reproducirá en el canal de cable de la ciudad de Waco aproximadamente a las 4:30 de esta tarde. Puede ver la conferencia de prensa en el canal 10 o por internet en vivo en wccc.tv. Larry, thank you again for the invitation.
Thank you. And your green behind you would make a great green screen for our television stations. Thank you, Hector, so much. Well, joining you today on our panel is certainly our host, our Waco Mayor, Kyle Deaver. We also have back, we missed you last week, Judge Scott Felton was Mclennan County Judge. Dr. Mike Hardin is substituting now for Dr. Griggs, who is normally here. He's from the Family Health Center. And Dr. Mark Eliason, who is with the Baylor Scott and White. Glad to have you back again. As well as we have Dr. Brian Becker, Chief Medical Officer from Ascension Providence. I think I've gotten everybody. I'll go through the outline that we will follow again. We will let each one of you make an opening comment, anything that's on your heart, mind, soul that you've been thinking about over the last week or more. Then we'll open it up and I'll ask questions that we've received throughout the week. Short week, frankly, when we were putting these together. Then we have three people who have registered from the media, and we'll have each one of those have an opportunity to ask two questions each. And then we'll allow for closing comments and we'll get wrapped up, hopefully shortly after maybe 2:30 or something like that. So let's open up with our opening comments. We'll start with Dr. Hardin from the Family Health Center.
All right, thank you, Larry. I will start by sharing some information and some data and then offering some commentary as we go along. So on this graph here that I've displayed first, you'll see the new cases per day per 100,000 population. And this is a way that we can compare data between areas of high population and low population. And we're comparing apples to apples instead of apples to oranges. So it makes it a little easier to compare. Mclennan County in this graph is the green line, a nice Baylor color green there. The orange line, which is kind of a dingy UT orange is Texas. I could say this, I attended both of these fine institutions, love them both, graduated from both, but I do love Baylor just a little bit more. And then the blue line is the United States. And you can see with the green line, we here in Mclennan County, we really never had much of a blip at the beginning. We've continued all the way here until we get to mid-June, and that's when we hit our spike here. And actually we spiked far higher than the United States and at least double that of the state of Texas as well. And we've continued to drop down since measures were put into place. We've dropped significantly and come down. We've had a little blip here towards the end, but we're on our way back down again. So that's good news in terms of the new cases per 100,000 per day. Now, I know Dr. Griggs has previously talked about some zones that we look at. And we look at a red zone, an orange zone, a yellow zone, and a green zone when we compare nationally. And the red zone is obviously an area where we're having a high number of new cases and we need to put significant measures into place to make some changes. And each one of these zones can help guide us in terms of the measures we put in place locally or statewide to make a change in the number of new cases and the spread of the virus. And you can see we were high in the red zone. That influenced how busy our hospitals were. And what was happening here locally in the community. That's dropped down. We dropped into the orange zone, and then we briefly went up into the red, and we're back down into the orange zone at this time. Will we ever see the green zone again? Honestly, I'm not an expert, but I doubt we will ever get to the green zone until we have an effective vaccine and enough people are vaccinated to reach herd immunity. A few places are in the green zone. We may get back down there again. Where should we be in this? That's a big debate question, and it's a question I can't answer, but there's a lot of considerations that go into that. It could be scientific or medical considerations, ethical considerations, economic considerations are in there, cultural considerations. We're very different from some other places. What does our culture dictate? And of course, politics never has anything to do with it, but politics may play in there somewhere too. And so no one has the right answers to where we're supposed to be, but it sure is nice to be down into the yellow range if we can get down there and still have a decent economy and people are not suffering at that point. The next slide is our positivity rate, which we've discussed before, and our positivity rate is the percent of tests that are turning positive. Obviously, the lower number is better. The more tests we do, that number drops, and the fewer cases we have, that number drops as well. We shot up very high, obviously that matches our prior curve, and we've dropped back down. And we're down in the 10 to 12% range now, which is great. It'd be nice to be even lower. National recommendations had recommended be down in the 5% range to be able to reopen. We followed this number as well in the past. This is the effective reproduction rate, or the RT, of the virus in the area, and that's a measure of how many people one person who's infected will infect. If that number is above 1, they will infect more than one person. If it's below 1, they'll infect less than 1, and the lower the number, the better. And it tends to be that if the number is below 1, the community spread will be decreased. And you can see Texas here has been below 1 for some time. We finally, Mclennan County, have now dropped below 1 again, or in about 0.92. And so that means and kind of predicts for the future that we should still continue to see a decrease. This next slide is one that we haven't shown before. And this data comes directly from the Family Health Center. And this is measuring influenza-like or COVID-like illness. And what that means is when someone shows up to the clinic and they have congestion, cough, sore throat, fever, anything that could look like flu or COVID, it registers in our computer system as this diagnosis. And this is looking only at ages 4 to 18. So this is school-aged children. And this blue line is an average of all the data over the past 3 years, from 2017 to 2019. And you can see on the far left, predictably in flu season, a high number of kids come into our clinic system. And this is 14 clinics and 60,000 total patients. So a large number of kids will come in for infections at that time, drops down through the winter. And as we get to spring, and when spring break comes, it kind of levels off. And the rest of the school season, it stays very steady here. When summer break gets out and everyone goes home from school and stops sharing germs, that number even drops further down to about 5 to 6 patients a day coming in. But then when school starts, typically and very predictably every year, that number will go right back up, kind of to where it was in the spring. And then as flu season approaches and cold season, that continues to go up. That's very predictable from year to year, but this year in 2020 has been a completely different year. And I'd like to show you that data, and I'll superimpose it with a red line here. So predictably, in the flu season, we had our flu, it dropped down, and then we get down to spring break time. And you remember what happened at spring break? No one went to school anymore after that. They all did it distance learning, and that number dropped dramatically down to around 5 range here, which is just as low as it is in the summer. And it stayed that rate all through the time that school was closed. And when society started opening back up again locally, that number quickly jumped back up higher than what it is normally during the school year. And we put our mask orders in place. That predictably dropped down again and followed what the adults were doing as well. But it never dropped quite as low as we would normally get in the summer. Unfortunately, that number was up there. We would have loved to see this number drop all the way down before schools reopened. Now, schools typically open here, and some school districts have locally have opened here, hybrid, some in person, some at distance. And then Waco ISD has just opened here as well. But unfortunately, we've already seen an increase in this number among school-aged children before schools have fully opened. We would predict that this number would probably continue to go up after schools open. And the schools have done a wonderful job and put in a lot of mitigation efforts in terms of masking and distancing. And we have no idea how that's going to impact these numbers. But these numbers serve actually probably as a leading indicator for us to indicate what's going to be happening a week or two down the road before a test turn positive or a number of cases show up. And as everyone knows, we're not as worried about these infections in kids in terms of mortality rate or deaths or a severe illness in children. It can happen, but it's very uncommon. But what we do worry about is the spillover effect. When it spills over from this population into an adult population, that's when things change and continue to spread from a community spread. So we'll continue to watch this data, and we watch this on an every other day basis. We plot these numbers to give us an idea of what's happening locally in our community here. And that's all the data I have to share, Larry. I'll pass it back.
Okay, thank you. Very interesting, very interesting. Dr. Brian Becker with Ascension Providence. Dr. Becker.
Thank you, Larry. And again, I'd like to thank our city and county officials, as well as the team of healthcare experts who have given freely of their time for all the effort being put in to managing this problem across our community. So thank you. I want to make sure I get that out front. I'd also like to thank the community. So over the Labor Day holiday, I have a sense that they heeded the warnings and limited social gatherings, made sure that they wore masks and practiced social distancing. And I'm hopeful that over the coming weeks, we'll see that we will benefit from that activity by at least no increase in our rate of positive testing. And hopefully we'll continue to see that decline that we have seen over the past week or two. I haven't mentioned in the past couple of weeks, and I think important to note, early in the course of this pandemic, there was a great deal of questions about how are the hospitals doing, and what's the status on PPE and staff and beds. And so just a quick update, Ascension Providence, we have adequate PPE, we have adequate testing supplies, we certainly have adequate beds and adequate staff. So from a hospital standpoint, we're in a good position to manage anything that walks in, and happy to continue to provide that service to our community. Again, I think important to mention flu vaccines. It's super important that folks begin to get that on their radar and begin to consider getting that vaccine over the next several weeks. Most often that starts in the 1st of October. I know some facilities have started to administer that vaccine already. So speak with your healthcare provider and make sure that you get that vaccine this fall is super important. And as always, continue to practice social distancing, good hand hygiene, and wearing a mask when in public. So again, thank you for having me today.
Okay. Dr. Mark Eliason from Baylor Scott and White. Dr. Eliason.
Thanks for having me back. Good to be here and good to participate. And also, a great shout out to our community and for the collaboration we've had between the city and the community and the universities and the healthcare systems. And so grateful to be a part of this and proud to be a part of this community as well. We are seeing a decrease in numbers in the hospital, and we are also seeing some successes. Can't help but feel that as we've seen more of these cases and seen more of these patients and have treated these patients, that we are getting better at treating them and recognizing patterns early on and instituting interventions early to help these patients. And so we've seen some great successes. Of course, we still do have patients in the hospital, and some of these patients remain critically ill, and we're doing our best to take care of them. Of course, can't say enough about prevention. Prevention is incredibly important with this illness because our therapies are limited, and it can be a fatal disease. Fortunately, it doesn't land most people in the hospital, but those that it does, it can be very, very difficult. It can make people very sick. And so again, prevention is very important. And it's not so much that it may hurt you, but you may be the means of passing on to somebody else who could seriously injure or even kill. So social distancing, masks, and small, limited social gatherings. Thank you.
Okay, Mclennan County Judge Scott Felton. Judge Felton? Judge Felton, are you muted? I can't see your image right now, so.
Sorry about that.
That's okay.
Good afternoon. I want to thank the medical community for participating with us directly in helping the mayor and myself communicate what we think is important for our community to know and getting it from different perspectives as well. While I was out last week, I know Dr. Jerry Mays of Region 12 was here to talk about schools, and we'll do that, I think, Mayor, from time to time, if you and I visited about that. I've always said it's about personal responsibility, really. I mean, we can try to set guidelines and rules, but we have to take it on individually as well. Just canceled our family reunion that generally happens on Labor Day, and of course, probably saved a lot of money doing that too. But I talked to a lot of the relatives around the state, and they all agreed that this is not the time to do that, so we canceled it. Also got my flu shot, and that's the other thing, as the doctor mentioned, they are available in some places, and mine might have been a little early, but I wanted to go early and get it done. So, but with that, I look forward to answering any questions later on in the meeting. Thank you, Larry.
Okay, thank you. Local Mayor Kyle Deaver. Mayor Deaver.
Good afternoon. Thank you all again for joining us today. Thanks again to all our panelists and for the City and Health District staff who make this possible each week. Over the last few days, we were able to enjoy the Labor Day weekend, and this week it's back to school for some of our largest school districts in Waco. The way we conducted ourselves over the Labor Day weekend and the way our students and their families conduct themselves over the coming weeks will have a huge impact on how our community responds to COVID-19. It'll take a couple of weeks for us to see the results of what we did or didn't do over Labor Day, and it will also trail a little bit behind these reopenings of schools. For now, the news is encouraging, as Dr. Hardin mentioned, and I'm cautiously optimistic about where we stand as a community. Our average new cases per day have come down over the last week from 77 to 51. That's a decrease of a third. One of the things that was driving the higher rate of new cases over the last couple of weeks was the reintroduction of college students into our community, and particularly Baylor students. As I've said, we are really glad to have all these students back in our town, and we expect them to work with us and adhere to the governor's order, the county's orders, and the city's orders as we work together to control the spread of the coronavirus. As Dr. Hardin mentioned, our positivity rate in Mclennan County is coming down. It is still too high at 12.1%. We need to get it below 10% and ultimately to 5% or below, but it is slowly trending downward, and that's really a good sign. Texas positivity rate has finally dipped below 10%, and the 7-day average as of Sunday was 8.8%. Again, trending down, and good news. But we must remain vigilant, and we will see whether we get a reversal in those trends as a result of the Labor Day weekend and school reopenings. I certainly hope that we don't. I do have just a few slides to share with you today. Let me get these up real quickly. So this first slide simply shows that we have been dealing with the coronavirus pandemic in our community since mid-March, about 6 months. This chart begins on June 1st because before that, our confirmed case count was so low in Mclennan County. Our total number of cases now are approaching 7,000. And we've had confirmed cases in about 2.7% of our residents. That is higher than the state average, which is about 2.1%. This next slide shows the number of new cases per day. And as we discussed, that has been coming down significantly over the past week, from averaging 78 per day a week ago to averaging just 51 per day as of yesterday. Our hospitalizations jumped some this past week. That is concerning. The number of patients on ventilators, however, declined. Hopefully, those patients that are newly hospitalized will not turn into cases that are on ventilators. We have very good capacity in our hospital right now, but we do know that patients who have to be put on ventilators are in critical condition, and that those who have to go on ventilators often have complications if they survive the disease. Finally, we had 5 deaths this past week. We've now lost 89 of our fellow Mclennan County residents to this disease. Our deaths per week have come down dramatically since early August, but they continue to be a serious concern, and we need to be cognizant of that and pray for those families. Larry, that's all I have for now, and let's get into the questions.
Okay, let's get going here. How many local cases are connected to local schools, and how many schools in Mclennan County does that represent?
Larry, your audio got a little garbled there. I don't know if that was, could the rest of you hear that okay?
Yeah.
Would you like me to repeat it?
Yeah.
Okay. How many how many local cases are connected to local schools, and how many schools in Mclennan County does that represent?
Okay, I think I made that out. There are currently 7 active cases among staff members and 10 active cases among students in 12 different campuses in Mclennan County. These 12 campuses are in 6 different ISDs. So the schools that have opened so far, I think, are doing a remarkably good job of keeping control of the coronavirus. I'm so appreciative of all the work that the administrators have done and that the students and parents are doing, and continuing to try to work with us as a community to keep the spread down.
Okay. How many people at the tax office have been confirmed to have COVID-19, and what is the risk to the public that may have been in the tax office recently?
Larry, that audio is just, I don't know what's wrong with the connection there from City Hall, but
okay.
Maybe it sounds okay on the air, but we can't make it out.
We're probably okay on the air because we have a separate mic going to our channel. So,
okay, Mayor, I'll answer that question. I think the question was how many people in the tax office have been confirmed with COVID-19. We have had an issue there, but I will say that the public, I think, is we've done a lot to make sure that they're very safe. There's shields and all of our employees wear masks, and there's a kind of a horseshoe type structure there where people come in and we do social distancing and line them up all the way outside when necessary. But we have had, because of the inside of there, even though employees are wearing masks and trying to social distance, it's a tight place and there's not much you can do about that. But we have had some positive cases in there, and currently have 8 out positive, and then 6 who are under contact tracing were sent home and monitor symptoms from there. But we have 39 employees, and so we brought in employees from other areas. We have 5 that have recovered from the COVID-19 and are back working. But as I say, we feel like for our taxpayers that come in, our citizens are safe. We put a lot of protocols around that. But I want you to know that you do have options. You can pay online if you're just trying to get your tax bill paid or your vehicle dealt with. We have a drop box, and then also for questions, you can call in. We have a bunch of folks on the phone bank handling calls and trying to deal with questions that you might have. There's one area where the title work is done for automobiles with dealers, and it's still open, and we haven't had any issues there. It's a little separate from the rest of it, but we continue to work on that, and it's not unlike a lot of businesses and where they are trying to operate and serve the public, yet have to deal with trying to keep the spread out in their own shop too. So we work with that as well.
Okay, let's try this. How many COVID-19 deaths have there been among nursing home staff since the pandemic began?
Larry, so far in our nursing homes, there have been 208 confirmed cases among staff and 321 confirmed cases among residents. Sadly, there have been 40 fatalities among nursing home residents in Mclennan County since the start of the pandemic. Nursing homes do not report deaths among staff to the Waco-McLennan County Public Health District. At this time, we're not aware of any deaths from nursing home staff in Mclennan County.
Okay. The Waco Tribune-Herald had an article in today's paper about the possibility of jury trials starting back up. Can someone bring us up to date on the status of trials in Mclennan County?
Judge, can you bring us up to date on what's happening with trials in Mclennan County?
I can. As you know, there was an article in the paper yesterday, and that's what the question was based off of. And I've gone over it and with some of folks here in the courthouse, and it's pretty accurate. But Office of Court Administration not allowed us to hold jury trials since, I believe, March the 8th. And since then, we have done certain judicial procedures, non-jury trial settings. But the big challenge that we have, the Office of Court Administration will allow us to start back and after October 1st. But there's still a lot of challenges. You know, with this, we have to meet the standards protocol for the Office of Court Administration, Public Health District, different rules depending on what venue. If we have to use outside venues to assemble juries, to select juries for each of the courts. Also taking into consideration public safeties on criminal trials as well, getting people that are currently jailed in and out of the courtrooms. And then also make sure that we convince the public that our process is safe, and people, when they get a jury notice, will show up and offer to serve on these juries. So we have a lot of challenges. Judge Strother was quoted saying that the preliminary or the estimated time to start is October the 5th. We don't know whether we're going to be able to get there or not. And so we're also monitoring other counties. Some of them have run test trials. We found challenges in every one of them. And so, you know, one of the issues is when you go through this process, you want to be able to have a trial that's fair and does not get appealed because they didn't think the health protocols were met. And so we have to look at a lot of different things. Very sensitive, it's very complex, and so not sure exactly when we'll get there. We're going to more than likely have some trials start in October sometime.
Okay. Why was there such a dramatic change in the number of active cases last week?
Larry, the short answer is we weren't accurately counting the number of recovered cases. There were a number of recovered cases that had not been added to our count. The number of active cases reported today is therefore much lower than previously reported last week. A recent quality control review by the Wake Up McLennan County Public Health District identified an incomplete reporting and accounting of recovered cases. And cases remain in the active category until they're counted as recovered. Their analysis revealed two main contributing sources. In the last week of June, the health district outsourced a portion of the case investigation and contact tracing to the Texas Department of State Health Services because we were in such a rapid rise and could not keep up with the number of cases here in McLennan County. These cases weren't added to the recovered count, so they were still marked as active. The action that was taken over the weekend was that all cases that have a date of collection more than 10 days ago and are not hospitalized or deceased have been marked as recovered. And again, that is an estimate. We don't have a way to be certain that all of those patients have recovered. So there is a little bit of room for error in those numbers, but it's the best that we can do at this point. In addition, there's a delay in getting reports of cases that were tested outside the county for persons living in McLennan County. Sometimes those delays last as long as 2 weeks. If we receive a case report that has a date of collection or onset that was more than 10 days ago, then the formula would not have added it to the number of recoveries for that day. So what the health district has done there is the formula has been changed to calculate the cumulative number of recoveries in place of counting the number of new recoveries each day. As we have discussed in the past, we're going to find errors as we go along with this. And when we do, we're going to take the proper action and correct them. The health district continues to strive to provide the most accurate information to our residents. And we are committed as well to providing that information as it comes out.
Okay. The CDC made a change in the number of deaths due to COVID-19. Is it true that only 6% of deaths are actually due to COVID?
Dr. Hardin, can you take that? Is it true that only 6% of the deaths are actually due to COVID?
Yeah, there is some confusion about this. And unfortunately, you know, when there's confusion, then the ideas come up that there's conspiracy there too. So I'll try to dispel as much as I can. The confusion comes to the fact that the CDC actually keeps two different lists of deaths. One is a provisional death list, and the other one is deaths from confirmed or probable CLI cases, COVID-like illness cases. And so those provisional deaths are recorded from death certificates, and death certificate data can be delayed anywhere from a week to 8 weeks. And so the initial reports of provisional deaths are always low, and those numbers are revised upward over time. And that has to do with just the process of submitting those death certificates. I actually went in and looked at the CDC site yesterday and looked at September 5th and looked at both of those lists. And the provisional list listed 128 deaths in the United States, and the case-based list listed 892. So a huge difference here. But that would be expected, as that provisional list will be updated day by day as those death certificates come in. You know, most experts who follow this feel like that we actually underreport the number of deaths in the United States rather than over-reporting them. And people have actually gone back and looked at archived copies of these records from the CDC to see if they've been changing numbers, and those numbers have not been changed over time. So I think this is one of those things where there was some misunderstanding and then a little bit of misinformation, and that led to some confusion, and then it progressed on from there. I'm not a social media person, but I've been told that this is out there on social media making the rounds.
Okay. Over the Labor Day weekend, the number of reported cases continues to show a decrease. And now with all area schools in session and the Labor Day pass, do you think we're getting to a level of what some people have referred to as the new norm of living with the virus for a while?
Becker, can you speak to that, please?
Sure. So I think normal is simply what we become accustomed to. And we've been wearing masks and we've been practicing social distance now for some time. So I think people are getting more comfortable with that, more accustomed to that. So I think that is becoming more of what we consider normal now. 6 months ago wouldn't have been so much for us. I think that until we get to a point where we have achieved herd immunity, where enough people have had the infection and recovered, or we have a vaccination that's effective in place, this is the new norm. I think people get a little bit annoyed with that term. They don't like that particularly, but it is the reality that we live in. Until we get to that point, I think it's incredibly important that we do all those things that we've talked about a number of times already, that we do follow what is safe for our community to prevent the spread. I do believe it's important that our schools take the actions that they have so as to prevent spread in that environment. And with all those things in place, hopefully we'll continue to see a decline.
Okay, with the hot, dry weather we've had, the threat of mosquito-borne illnesses like West Nile, Zika, and chikungunya has been low. But with all the rains lately, mosquitoes will be more active. Can the coronavirus be spread by mosquitoes?
Larry, I'm getting mixed reports from the public that are texting me. Some can understand what you're saying and some can't. I think it may depend on what channel they're watching you on. So if you don't mind, let me take the questions for a little while and see if we can get the audio cleared up on your end.
Okay.
Just so we can be sure that everybody can hear the
We're getting
well.
We're getting reports that our channel is okay, but those who are repeating it on another channel maybe are having problems.
I think we're getting people that are seeing it on TV that are having issues too, maybe depending on the channel they're watching. I'm not sure what the issue is, but let me go ahead and read these questions for a few minutes, and then we'll, if we can get yours cleared up, great. If not, we'll take questions from the press in about 10 minutes. So the question was, with the hot, dry summer we've had, the threat of mosquito-borne illnesses like West Nile, Zika, and chikungunya. Thank you. Has been low, but with all the rains lately, mosquitoes will be more active. Can the coronavirus be spread by mosquitoes? And Dr. Eliason, if you could take that, please.
Yeah, sure. And the good news is no, that it cannot be spread by mosquitoes. And so there was a study done by Kansas State University early on in this disease process where they tested mosquitoes, and they found that the virus does not replicate inside a mosquito. And so even if a mosquito bites somebody who has COVID-19, the mosquito cannot transmit that to someone else.
Okay, thank you, Dr. Eliason. Next question, and these questions come in from the press and others ahead of the press conference, so we do have these ahead of time. Overall, the number of cases being reported over the last week is getting smaller, with the exception of those in the 18 to 29 year of age category. Do you think that this age group doesn't seem to care, since typically their symptoms are very mild and they don't see the coronavirus as a serious personal matter? Dr. Becker, would you please take that?
Yes, sir. So I think it's kind of harsh to put them in a bucket that says they don't care. I suspect that they do care, whether it's about the health of their family or their own health and safety, or simply the fact that if they contract the illness, they're isolated for 14 days, and that's not a very pleasant place to be either. So I think they probably do care. I think it is important to understand that while not common, people in this age group can get sick as well, can require hospitalization. And so important not to just discount that I'm not going to get sick because I'm young. It is possible. And then, as I alluded to earlier, it's also possible to give this to a loved one, to a relative, to someone that you're close with. So important reasons to practice social distancing and wearing a mask and avoiding large social gatherings. I think that's an age group where those are common occurrences as well. So I think that particular population, with the close of summer and the beginning of school, it was expected to see an increase in that population. I'm hopeful that they are as concerned about public health as we all are, and will do the right thing for all of us.
Thank you, Dr. Becker. Sorry. So the next question is, do you expect to see a spike in the cases following the Labor Day weekend, along with the high school football games that are happening on Thursdays and Fridays now? Dr. Eliason, can you speak to that?
Yeah, I hope we don't, but the likelihood is probably we will. As people are interacting more, whether that's football games or whatever it is, but as people interact more, we're going to have more possible interactions where people can contract the illness. So yes, I'm expecting some increase, but I sure hope it's minimal, and I hope I'm wrong. So again, just as Dr. Becker said and others have said, be wise, be safe.
Thank you, Dr. Eliason. Dr. Hardin, if a person tests negative after testing positive, do we then remove them from the counts? And if not, why not?
No, we do not remove them from the count. So when you test as a new positive, you are added into the count as a new positive case. Let's say you test positive, and then for some reason, the next 3 months, you have another test and it turns positive. You're not added again. You're just counted once as a new positive. Let's say you test positive, and then for some reason, you have another test and you test negative. You're not removed from that count. A positive is a positive. So a positive test means you're either about to have this infection and have symptoms, you have the infection, or you have had the infection, whether you know it or not. So that positive test is a positive, and we do count that. It's important that we do count every single positive once when they have it, because that's what gives us our accurate data to be able to follow the statistics here locally.
I know that we've had situations where healthcare workers and others have been trying to get tests, because some healthcare workers are required to get 2 negative tests before they can return to work. And I think we've addressed this on other press conferences, but my understanding is those positive tests are not counted as new cases. Is that your understanding as well?
If it's a repeat positive, so if they've been counted once, they're not counted another time. Correct.
Okay, very good. Thank you. Okay. Next question is, in a previous press conference, Governor Abbott had mentioned Labor Day as a point in time for a reevaluation of the orders he's issued. Do you know of any potential changes he may be considering? Judge, as far as I know, we have not heard anything directly from the governor about any potential changes. I know he is anxious to reopen more sectors of the economy, but he's also said that he would want to see the positivity rate below 10% for a sustained period of time, and be sure that the hospitals have plenty of capacity before they move to reopen another segment of the economy. Our hospitals, certainly here in Central Texas, I think largely across the state, have capacity at this point. We have just this week gotten below the 10% line on the state positivity rate. So I would think it might be another few weeks before we see something. Judge, do you have any other opinion about that?
I don't know of anything else. It would make sense that you would hold off a little bit because of all the fall activities that are just now starting up, and you need to see those through for several weeks to see if there's any virus activity due to those coming up. But I've not heard anything out of that office.
Okay. Me neither. One thing that he has done is advised, or the TABC has advised, is a lot of bars that they have the option of reopening with a food and beverage permit. And so that's not really an official change from the governor, but it has allowed some reopening in that segment.
Right.
Larry, you want to try again and see if maybe we can get your audio working better now?
I'll be happy to. It sounds like from what we're hearing, are you hearing me better now?
Much better.
Okay. I don't know what's going on, but our transmitter and our live stream has all been reported good. Facebook, we got 120 people following on Facebook. They're hearing it good. So anyway, I've heard that one of the TV stations is retransmitting, and that might be it. Let's move on. Will the small business program reopen? And if so, can businesses who have previously applied and awarded to receive additional funding?
Larry, right now, the city doesn't anticipate reopening the program. Staff is currently evaluating the applications that have been submitted. To date, the city has awarded 208 businesses and 198 businesses have accepted that assistance. I want to be clear that this is funding that was provided by both the city and the county through the Waco Mclennan County Economic Development Corporation, as well as some funding that came in through the CARES Act and our CDBG allocation. The city has a fund balance of $235,000, a little over $235,000 at this point. And while we still have other applications to review, we're uncertain of whether those businesses will qualify under the CDBG funding, which would be important in order to get them the maximum amount of funding. The funding request for applications to be reviewed is about $300,000 now. So with all of that in process, we don't anticipate reopening the program for more applications at this point.
How long will the rental assistance and foreclosure prevention program be open?
So the rental assistance program will be open until all those funds have been exhausted, and very few of those funds have been expended at this point. So if you are in need of rental assistance, please go to the covidwaco.com website and look for, I believe it is under, it's either under assistance or some other heading. I'll find out here in a minute and reiterate it at the end. But go to the covidwaco.com website, and I think you'll be able to find the application to receive rental assistance.
Okay. How long will it take to process my rental assistance and foreclosure prevention application if I get one, if I apply for one?
I'm told that it takes about 14 days upon the receipt of all the completed necessary documents. So about 2 weeks once you get the documentation in.
Okay. Well, why don't we stop there and let's just go to the media and see how well they've been able to hear and what's going on. We have 3 representatives from the local media. We have Brooke Crum from the Waco Tribune-Herald. We have Drake Lawson from KWTX News 10 and Shaquille Amari from Fox 44. So each one will have an opportunity to ask 2 questions, one at a time, and we'll make a kind of a round robin type thing. Let's go first to Brooke Crum from Waco Tribune-Herald. Brooke, are you on the line?
Yes, I'm here.
Would you ask your question, please?
Good afternoon. My question is, have there been any local cases of reinfection of a person who's had COVID-19? Not just testing positive, but a reinfection.
Sure. Someone who has ostensibly recovered and becomes infected again is what you're asking about.
Right.
Right. I don't believe that we have been told of anything from the health district. Kelly, or can you answer whether we've had any persons that have?
She says no.
Okay. So the answer is, I always forget that Kelly is sitting there in a room and she knows the answers better than most of us on the press conference. Thank you, Kelly. So the answer to that is no, Brooke.
Okay. Thank you, Brooke. Drake Lawson from KWTX News 10. Drake, are you on the line?
Yes. Can you guys hear me okay?
Yes, we do.
Perfect. Yeah, I just wanted to ask about, the big Baylor football game postponed this weekend. kind of out of Baylor or Waco's control with what happened at La Tech. However, this might have some financial impact for people in and around the Waco area, hoping that there was going to be people going out to watch the game and whatnot. Does this concern you at all, Mayor or Judge Felton, and the fact that, this could be a reoccurring thing if people catch COVID, or even with the 25%, that there might not be as much economic value out of these football games as there's been in years past?
Judge Felton, would you like to address that?
Well, obviously, they all have, most of these activities have some level of economic impact back to the community. And if they're canceled, like this football game was, there's money that's not going to be spent here in our community. And more than likely, we'll see, more of that. I'm not trying to be predictive, but it just makes sense that this could happen on other games, and even get out into high school and events like that. So this is the time where you really look at the direct effect of the economy, what the virus has on the economy, and those are things that we try to take into consideration and understand that. But the hotel people are really taking a rough ride on this thing, and they're hoping to get this behind them, but I think there's going to be a little bit more time before that happens.
Okay,
Judge, I agree, and I would say that as we've said before, this certainly impacts certain sectors of our economy in a more direct way. Overall, our economy is not that dependent on one Baylor football game, or even 5 or 6 Baylor football games in a home season, but we certainly would like to see those games played as long as they can be done safely. And in this case, the hurricane sent a lot of evacuees into the area where Louisiana Tech is, and they had to make the decision that they had too high a rate of cases to play the game. And those are the kind of tough decisions that are going to be made all over the country all year long.
Okay, Shaquille Amari from Fox 44. Shaquille, are you on the line? I don't see him. I don't see Shaquille. Okay, we don't have Shaquille on the line. So let's go back to Brooke Crum for another question from Brooke. Are you on the line still?
Yes, I'm here. Thanks, Larry. Have we seen any spread in any of the local schools that you mentioned earlier, Mayor?
As far as I know, it's been very isolated in schools. No more than 1 or 2 per class, per school. So I don't think that what we've seen so far has been any kind of community spread within the schools. I think the schools have done a really good job so far. And we know that first some of those first cases seem to have been spread from an off-campus party before school had even, maybe the day that school started. So it again is going to be largely up to parents and students to do things away from school and refrain from doing things away from school that can spread the disease. But as far as in class spread, Kelly, I'll ask you again. We don't know of any of that at this point. Is that correct? She's saying
that's correct.
Okay, thank you.
Thank you.
Okay, one more question. Drake Lawson from KWTX. Drake?
I'm good, Larry. I got everything I needed. Thank you, guys.
Thank you all for being on the line with us and everything. Well, that wraps up our questions and things. So let's move to the closing comments. And if you would, we'll go in the order of Dr. Becker, Dr. Eliason, Dr. Hardin, Dr. Felton, Judge Felton, and then wrapping up with Mayor Deaver. So if we would, Dr. Brian Becker from Ascension Providence.
Thank you, Larry. Thanks again for having me here this afternoon. It's always a pleasure. I mentioned last week, and I want to reiterate again, it's important that folks not ignore chronic health conditions. Members of our community that have high blood pressure, have diabetes, should continue to seek care with their physicians and regular visits, whether they're virtual visits or they're in-person visits. It's really important to take care of those chronic health conditions so that they don't run into issues that require hospitalization. In that same vein, important not to to delay care if there's an urgent or emergent condition that presents. All of our local healthcare facilities have gone to great measure to ensure the safety of patients when they show up to receive care. So it is a safe place to go. As I've said earlier in this press conference, flu shots, I can't recommend highly enough that everyone go and get their flu vaccine. And then last, again, important to continue to do what is important for our community. And we must all do our part to stop the spread of this virus or mitigate the spread of this virus and continue to practice social distancing, wearing a mask, and hand hygiene. So again, thank you for having me, Larry.
Thank you. Dr. Mark Eliason from Baylor Scott & White.
Yes, thank you again for having me on the program, and proud to be part of this community and part of our healthcare system. Again, just want to, last week I gave an excellent thank you to our team members, but we have a lot of people who've been working hard, valiantly, tirelessly, and courageously taking care of these sick patients, with some risk to their own health. And so want to thank our nurses and our aides and our physical therapists, occupational therapists, speech therapists, respiratory care therapists, and many, many more people who are contributing and caring, including housekeeping services. So thank you to them, and thank you to our community. It is important to slow the spread of this illness. I think there is hope and an end in sight. It's not here today, and it's not going to be here next month, but if we can slow this down, then we can save people's lives just with simple prevention. Thank you.
Thank you. Dr. Mike Hardin from the Waco Family Health Center.
Thank you again, Mayor Deaver, Judge Felton, Larry, for being on here again. And I want to echo what Dr. Becker said. Flu shots are super important this year, more than ever, basically. It's going to be very confusing when January comes, when we have both COVID-19 and the flu breaking out at the same time. There are very few excuses. Well, I hear a lot of excuses. There are very few good excuses not to get the flu shot. And as Dr. Becker said, we know the game that we're in now. This is not a sprint. This is a long race. We all know the playbook. We all need to do our part as a team sport to be able to mitigate the spread of the virus and have a good impact on our local area here. I'm an optimist, so if you put this as a baseball game, this is not a doubleheader, and I don't think we're gonna have extra innings. I think we're probably in the fourth inning right now. I hope, and I'm an optimist, so we'll see where we go. But we are not through this yet. We're in it for a while. We know what to do, and so I just urge everyone: you get tired, you get fatigued of doing these things. I want to go out and I want to visit some people, and it's very hard. I urge you to think of others when you make these decisions, because that's really the most important. Thank you.
All right. Judge Scott Felton.
Well, the fall always brings hope, and I'm very hopeful and thankful too. We got quite a bit of rain last week and this week, and that's temperatures dropping a little bit, so that's good. I'm real thankful for the type of people we have in this community, the medical community, the education community, leadership of the communities that really care about making this place a great place. And, I think also a lot of people that set examples on how to approach problems like this. And of course, one is taking care of yourself, and that'll help you take care of others. Again, I would say to shop local, and I think it was said a while ago, be wise and be safe, and I think that's a good way to live every day. So thank you, and enjoyed being with everyone.
Thank you, Judge. Waco Mayor Kyle Deaver.
Thank you, Larry. Thank you, Judge Felton, Dr. Hardin, Dr. Becker, Dr. Eliason. Again, it is always great to have all of you here and helping to get the word out to our citizens about what's going on, how we're responding, what they need to be thinking about in this long, extended battle against the coronavirus and trying to keep the pervasiveness of it low here in our community. Larry, thanks again to you and your team, and Julie, to you and the city secretary team, and Kelly Crane. all of you at the Waco McLennan County Health District. I want to follow up on a question that was asked earlier about rental assistance. If you'll just go to covidwaco.com and in the search box, type in the word rent, you will see all the information regarding rental and mortgage assistance that is available, which is up to $2,400 per family, including a link to the application. And if you're having problems making your rent because of the coronavirus, I would really encourage you to do that, your rent or mortgage payments. Thanks to all of you who are viewing this press conference and who are doing everything possible to contain the spread of the virus in our community. Your actions are making a difference, and we have seen the improvement over the last week. As we've discussed over the past couple of weeks, churches are continuing to reopen for in-person worship. And I continue to ask pastors and other church leaders to help your members be careful as they return to worship. If you are returning to church, please be sure to wear a mask when you are entering and leaving the sanctuary. And please be sure to maintain at least 6 feet distance between you and those around you when you're in the pews. We know that singing, especially singing loudly in a closed place, is a way that this disease is spread. And because of the asymptomatic and pre-symptomatic nature of the spread of this virus, it's impossible to know whether you or the people around you may be sick and capable of spreading the disease. So just please take that into account when you're deciding whether to return to church and how to worship when you go. I want to remind you that next week we will have more free testing. The Waco McLennan County Health District has teamed up with the Texas Department of Emergency Management and our Emergency Operations Center again to offer free testing over the next 3 weeks. Next week on Wednesday and Thursday at Tolliver Chapel Missionary Baptist Church on Elm, there will be drive-through testing from 8 to 5. It is free. Again, there are no symptoms required, and it's the cheek swab, which is a much more comfortable test. Registration is required for the testing next week. So if you're interested, go to covidwaco.com and click here for free COVID-19 testing, more information. You'll also see the information about other upcoming free testing over the next few weeks. I'm going to say it again, even though it's been said 4 or 5 times already, get your flu shot. Even if you don't normally get a flu shot, or you sometimes do and sometimes don't, this is the year to get it. I'm going to get mine this week. I know Judge said he's already gotten his. They are becoming much more widely available across town at different pharmacies and many outlets around town. So please do that. It will make a huge difference as we get into the fall and winter for our hospitals and for yourself. So take care of yourself as always, and take care of one another. Waco, we are getting through this together, so just keep it up. Thank you.
Thank you. I want to thank all 5 of you all for continuing to be there for us and making us available, whether you tune in, tune off, or whatever, but they're getting the word, and the media is taking it from here, and I appreciate that. And I want to thank all of you all for watching and viewing, and sorry for any technical problems, but our goal, like the mayor said, is to get the word out to you, and together we will get through this. Thank you for joining us. Have a good day.